My name is Steve Kilburn, and I am a Grant Projects Director at the Chautauqua County Department of Mental Hygiene. And as we get started on what we expect to be a very full, a very interesting, and we fully expect a very inspiring day, we are honored to have some of our Chautauqua County government leaders to get things started for us with their welcomes. PJ Wendel is our county executive, and he is a strong advocate for the behavioral health needs of our county. So, County Executive Wendel.
Thank you very much, Steve, and thank you for the introduction. Good morning, everyone, and thank you for joining us. Today is a perfect day with the sun shining here in Chautauqua County to connect and to be inspired. Before I go any further, I'd like to acknowledge the Planning Committee for today's Hope and Healing Conference. I know the time, effort, and energy and heart that is required to host such an event. The Planning Committee is comprised of many people in our community and partners that join us in the prevention, treatment, and recovery efforts surrounding the behavioral health challenges our county faces. As Steve said before, I'm very committed to this. I spent 25 years in the educational system. I also spent years where I first met Steve many moons ago, working as an ER technician back at the hospital in WCA when it was privately run as a local not-for-profit. And the reason I say that is because I was oftentimes involved and engaged with our behavioral health units in working with the clinicians and our counselors. So again, a great deal of history on my part, but a great deal of compassion and a passion to make this system, very workable and something that I put a lot of pride in, especially with our CCMH. But because of this, I know that today's conference is a passion project and one that is heavy on the heart. So again, I'll thank you. We consider the landscape of behavioral health in our area. We cannot overlook the data. It's important to know for us that we are currently, where we have been, so we can better determine a path and make adjustments to where we need to go. Data can be scary. In particular cases, it truly is. From 2019 to 2020, there was a 54% increase in non-fatal overdoses and an 18% increase in overdose fatalities. Again, as an EMT for 26 years, I've used Narcan and seen it save lives. So again, a personal experience and a personal relationship I have with these situations we face here in our county. But these statistics are tragic and they represent loss, but they also indicate that there is some success. We're thankful that these percentages are not the same. We're thankful that they're both not 54%. This year's statistics are also scary as the number of fatalities for drug overdoses are increasing as well. I don't want to paint a dark picture, but it's important that we remember that the uncertainty comes from fear, and with knowledge comes hope. As I said before, we need to know these numbers, but we need to also have hope. Hope that there's an effective prevention, and hope that there are treatment options available, and hope that recovery is possible. Healing our community is a shared effort. We rely on support from everyone as we face the behavioral challenges in our regions today. But the effort does not solely weigh on the shoulders of therapists, clinicians, or social workers. Our team includes law enforcement, families, educators, neighbors, faith-based communities, students, emergency response workers, lawmakers, and as I said before, even myself. I know that by joining us today, that includes all of you as well. By definition, hope is a feeling of expectation and a desire for certain things to happen. It can also mean a feeling of trust. I know that there is a strong desire to tap into the power of collective action as we will all grow and learn together today. Today, we celebrate a county commitment to meet the needs of our community members with substance misuse and mental health challenges. Today, we make a commitment to increase awareness surrounding behavioral health challenges and reduce the stigma associated with them. Our region is a resilient one, and one where the depth of our resources are great. Today's conference is indicative of why we are well equipped to serve community members in need and build a healthier Chautauqua County. I trust that we all can do this together, and I trust that we can heal. Thank you for joining us today, and thank you for being part of our team. And as I've said throughout our pandemic, and much like the epidemic we face now with our substance abuse and mental health crisis, stay healthy, stay safe, and continue to be CHQ strong. Thank you.
Thank you, PJ. We really appreciate that. Christine Schuyler is the director of our county's Department of Health and Human Services, and we very much appreciate her as well joining us this morning. Good morning, Christine.
Good morning, Steve. Good morning, everyone. Thank you so much for inviting me to say a few words this morning. That really means a lot to me, and a beautiful sunshiny day we have here in Chautauqua County. And I couldn't think of more important words to say at this time in our nation than hope and healing. You all know this has been a very challenging last year or so. We're 15 months or so into this pandemic. And as we see on the horizon our way out, hope and healing is going to be integral to that. What do we hope to see as we emerge from this pandemic? I think we all hope to see a much more accepting world. I think we hope to see development as a community, more empathy towards one another, reduced stigma for those who are suffering from mental health issues, substance misuse, and also physical disorders. We have seen some have triumphed during this time. They've been able to reconnect with themselves, their families, their lives have slowed down, and it's been a positive thing. But we've also seen the opposite for others, where it's become more insular and they've become isolated and alone. And sadly, we've seen the results of some of that in our instances of mental health episodes, as well as our overdoses and suicides. I hope that you all can take the day today, truly think about what hope and healing means to you, to your family, to your organization, to our larger community as a whole. I think we would all prefer that this world be a kinder and more understanding and more empathetic one, and especially to stop for a moment and really consider what we've all gone through alone and together. And I hope that all of that will bring us closer. There is growth through shared experience. And I think by the time this conference is over, there will be increased growth through the shared experience of today. I hope everyone enjoys the day. I'm very excited that some of my staff are your presenters today. I'm very confident in their ability to share some very worthwhile information with you. I'm really looking forward to next year, when I won't feel weird sitting here talking to myself on my computer, and that we will be back together in a large conference forum and being able to really share a more personal experience. But in the meantime, thank you again so much for having me here today. And thank you, Steve and County Executive Wendel, Melanie. Please, everyone, enjoy your day. Thank you.
Thank you, Christine. We really appreciate your being here with us as well. And Misty Pennington is the interim director of the Chautauqua County Department of Mental Hygiene. Thank you as well, Misty, for joining us.
Thank you, Steve, for the introduction. We know that the behavioral health landscape is vast in our area and that it takes all of us to support it. Through venues such as this conference, we share a mission to save lives by building healthier communities. Together, we are a collaborative effort to make a positive impact on addiction and behavioral health challenges that exist here in Western New York today. Exploring new ways to treat, heal, and support our community members and improving access to behavioral health care continues this movement to reduce stigma and misperceptions surrounding addiction and mental health. It brings us closer to being that healthier community. After today, I hope that you are as motivated and encouraged as I am, that we are better able to serve our community members at risk. I want to thank you for being here. I want to thank you for doing your part. Your attendance shows me that prevention, treatment, and recovery for behavioral health challenges are just as important to you as they are to me. On behalf of the Chautauqua County Department of Mental Hygiene, I want to express just how excited we are to be here today and to be honored in such good company. Enjoy the conference.
Thank you, Misty. Thanks to all of our county leaders for their support for today's conference, but also for the many efforts that take place here in our county and in Western New York, efforts that do bring hope and healing.